Hello everyone, my name is Fatma Mohammed Ismail and I'm gonna talk about the role of anti-carbohylated protein antibodies and anti-cyclic citrullinated peptide in rheumatoid arthritis Egyptian patients. Rheumatoid arthritis is a systemic autoimmune disease of unknown etiology that is characterized by chronic joint inflammation, which often leads to joint destruction. It affects 0.5 to 1% of adults worldwide. Autoantibodies in rheumatoid arthritis patients provide many clues to the underlying disease pathophysiology, and their formation is associated with environmental risk factors such as smoking. One example is protein citrullynation, which promotes the subsequent development of anti-citrullinated protein antibodies, usually measured as anti-cyclic citrullinated peptide. Several autoantibodies against the protein with other post-transitional modifications have recently been reported and are called anti-modified protein antibodies. The second most researched anti-modified protein antibodies following anti-citrullinated protein antibodies are anti-CarP protein antibodies. They are the antibodies of protein with carbamylation. Our objective is to estimate the amount of anti-carbohylated protein antibodies in comparison to anti-cyclic citrullinated peptide in serum of rheumatoid arthritis patients with variable disease activity. Subjects and method: measuring serum levels of both anti-CCP and anti-CarP using ELISA kit, which uses sandwich ELISA as the method in rheumatoid arthritis patients after classifying them according to their disease activity into low, moderate, and high disease activity. Our results show significant increase in anti-CCP in patients with moderate and high disease activity compared to the control, while no significant difference between patients with low disease activity compared to the control. Significant increase in anti-CCP in patients with high disease activity compared to those with low activity. No significant difference between patients with low disease activity compared to moderate activity. And there is significant increase in anti-CCP in patients with high disease activity compared to those with moderate activity. For anti-CarP, there is a significant increase in patients with low, moderate, and high disease activity compared to the control, while no significant difference between patients with different grades of disease activity. ROOC curves for diagnostic accuracy. For anti-CCP, it shows 90% sensitivity, 75% specificity, while for anti-CarP, it shows 100% for both sensitivity and specificity. Our study reveals that anti-carbohylated protein antibodies could be considered as a candidate biomarker in rheumatoid arthritis, as it shows high sensitivity and specificity in comparison to anti-CCP. Coexistence of anti-CarP antibodies and anti-CCP promote diagnostic efficacy. This provides us with a new viewpoint of etiology and pathology of rheumatoid arthritis. Finally, rheumatoid arthritis has a significant negative impact on the ability to perform daily activities, so I have an important advice to you. Never ignore any of these symptoms. Pain often starts in fingers and toes and spreads to other joints. Joints look red and discolored. Pain in the big toe, disrupted sleep, weight loss, and I hope all of you never experience any of them. Thanks for watching, and I'm honored to share my research in the first international online conference of pharmaceutical and medical science.